Now, I cordially invite our first speaker, Dr. Venkatesh Karthikeyan. He serves as a senior resident in the Department of Community and Family Medicine at AIIMS Patna. He holds prominent positions including Publication Director and NCD Chair at World Medical Association JDN and the National Conveyor for the Antimicrobial Resistance at the Indian Medical Association. Additionally, he is the Director of Medical Education for the Commonwealth Medical Association, and the National Vice President of the Indian Association of Community and Family Medicine. Dr. Venkatesh has authored more than 25 publications in reputed international and national journals. Today, Sir will deliver the session on global and national situation analysis of non-communicable diseases. Over to you, sir.
Thank you so much, Dr. Krishna Jasani. Is my screen visible? Am I audible and is my screen
Yes,
visible?
sir.
Okay, okay. Thank you so much once again. So, first of all, a very good afternoon, everyone. Thanks to the head of Department of Community and Family Medicine, the Deputy Director, sir, Dr. Kripal, sir, Dr. Krishna, and the whole of CFM department. I would like to thank, and also at the same time, I would like to congratulate you for organizing this timely session because parallelly, the United Nations High Level Meeting for Non-Communicable Diseases is going on this week, and in a very timely fashion, this meeting is being organized. So I congratulate and thank you all for giving this opportunity. So, in the next few minutes, I'll discuss in brief about what is the global and national situation of non-communicable diseases. As we all know, non-communicable diseases are also known as chronic diseases. They tend to be of longer duration, and that's how it got its name. And they are a result of combination of various factors like the genetic factors, physiological factors, environmental factors, and behavioral factors. If we see the global burden, WHO estimates that NCD kills at least 43 million people in the year 2021 alone. That is around 4.5 crore people across the globe die due to NCDs, which is equivalent to 75% of the non-pandemic related deaths. And 18 million of this 43 million deaths is a premature mortality, that is death before 70 years of age. And of all these premature mortalities, 82% of premature mortalities comes from low and middle income countries like India. So our country and other low and middle income countries, they have a highest burden of non-communicable diseases. And of all the NCD deaths, 73% of deaths come from LMICs like India. This is just a comparison of how trends in NCD related mortality is there across different regions of the globe. So if you could see, I'll just turn on my pointer. Yeah. So if you could see, the highest burden in the year 1990 was in high income countries and high socio-demographic index countries like Switzerland, Germany, and Singapore. But the trend is gradually changing, and you could see the top burden is now faced by Southeast and East Asian countries. And if you could see, with regards to number of deaths in India, there is 457 deaths per lakh population related to non-communicable diseases. And if we talk in terms of percentage, 55 percentage of total deaths in India is due to non-communicable disease. And you could see in dark red color in Southeast Asia and other high-income countries, the mortality and burden of non-communicable diseases is much more higher. If we take the year 2021, cardiovascular diseases accounts for most non-communicable diseases. The top four NCD diseases include cardiovascular disease, cancer, chronic respiratory disease, and diabetes. So here, cancer accounts for 10 million deaths, chronic respiratory disease accounts for 4 million deaths, and diabetes accounts over 2 million deaths, including chronic kidney disease, which is usually caused by diabetes. So these four group of diseases, that is cardiovascular, cancer, chronic respiratory disease, and diabetes, these four constitute 80% of all premature non-communicable deaths. That is deaths before 70 years of age. And in the meeting which was happening last year in the UN, in the United Nations, it was discussed that 1.3 billion adults are living with hypertension. That is 20, and of these, only 20% have blood pressure under control. Similarly, 800 million adults are living with diabetes in the world, and 1 in 5 per person in the world have the risk of developing cancer throughout their lifetime. And with 20 million new cases are coming up every year, of which 400,000 cancers are seen in children. 3.7 billion people suffer from oral diseases, and more than 674 million people are affected by chronic kidney disease. So this is the latest picture we have with regards to global scenario, and what are the top NCDs which are causing the deaths related to NCDs. We often tend to ignore mental health, but we should always keep it in mind that mental health are also coming under the banner of non-communicable diseases, and it includes anxiety, depression, and psychosis, which is affecting close to 1 billion people worldwide. So, around 100 crore people across the globe are suffering from mental health conditions. And suicide is the third leading cause of death for those between 15 to 29 years of age group. NCDs and mental health are very closely intertwined. If you see mental health conditions, they contribute to increasing burden of NCDs, and people who are living with mental health and neurological conditions, they tend to have increased risk for non-communicable diseases. With regards to the top causes of deaths across the globe, if you see in 1990, let us take the first five top killers. So, cardiovascular diseases and neoplasms, only two non communicable diseases were in the top five reasons or causes for mortality across the globe. But now, if you take the scenario of 2021, out of top five reasons for death, top four reasons, first, fourth, and fifth are due to non-communicable diseases. And this is the global scenario. What is in India? In India, if you see in 1990, if you take the top seven causes for death, only two NCDs are there. Whereas in 2021, over a span of 2 decades, the scenario has completely changed. Out of top seven different causes of death, four causes of death are due to non-communicable diseases like cardiovascular disease, chronic respiratory disease, neoplasms, and diabetes and CKD. So this clearly reflects the growing burden of non-communicable diseases, especially in our country. And this is again a comparison between global and national scenario. If you see across the globe, 65 percentage of deaths are due to non-communicable diseases, whereas in India, 55 percentage of deaths are due to non-communicable diseases. But what is more concerning to me is that the annual change in percentage for non-communicable disease related death is 0.34 across the globe. But if you take India, 1.3% of there is an annual percentage change of 1.3 percentage for the NCD related death, which is highly concerning. Again, this shows that there is uniformly equal burden of non-communicable diseases that NCDs are increasing across the different states of India. And among those NCDs, what are the top NCDs which are causes for death? If you take the global picture in 1990 as well as in 2021, the top three NCDs are cardiovascular diseases, neoplasms, and chronic respiratory diseases. In India, the scenario is little different. The neoplasms are in third place, and chronic respiratory disease are in the second place. So the other reasons for death include diabetes, digestive disorders, neurological disorders, other NCDs, substance use, musculoskeletal disorders, skin diseases, and mental disorders. So these are the top 10 or top 11 NCDs which are contributing to total number of deaths, growing number of deaths in the country. Just sharing few slides from the recent National Family Health Survey 5, which is 2019 to 21 data. Here we could see that 21.3% of Indians are hypertensive. That is, they are having a systolic blood pressure of more than 140 or diastolic more than 90, or taking the medicines to control blood pressure. 21.3 percentage of women and 24 percentage of men are hypertensive. And if, with regards to diabetes, 15 percentage of men and 15.6 percentage of men and 13.5 percentage of women are having a blood sugar of more than 140 or they are taking medicines to control the high blood sugar levels. So we have discussed about the mortality. Now, a few slides about few points about DALI. So as you may be aware, DALI stands for Disability Adjusted Life Years, which is nothing but the sum of years lived with disability and the years of life lost. Globally, if you see, uh, the distribution of DALI is again high in Southeast countries and high income and high socio-demographic index countries. In India, 55 percentage of the total DALIs are contributed by non-communicable diseases. Whereas if we see the global average, around 60 percentage of the DALIs are caused by non-communicable diseases. So, how are these non communicable diseases caused? Why are they caused? The risk factors include behavioral risk factors, environmental risk factors, and metabolic risk factors. The behavioral risk factors include tobacco use, which also includes the exposure to secondhand smoke, and then unhealthy diets, including excess salt, sugars, and fats, harmful use of alcohol, and insufficient physical activities, or the various behavioral risk factors which may lead to non communicable diseases. And if we see what are the metabolic risk factors, raised blood pressure, including hypertension, overweight, obesity, diabetes, and high blood glucose level, abnormal blood lipids, including high cholesterol, are all metabolic risk factors which may lead to non communicable diseases. This most of us may be aware. But what most of us fail to ignore or fail to not pay much attention is the role of environmental risk factors like air pollution, in both indoor and outdoor air pollution, radiation, noise, land use patterns, work environment, and climate change. These are all environmental factors which may lead to development of non-communicable diseases. Now, a lot of work is going on in climate change related activities, and the intersection between NCDs and climate change is explored and addressed in the recent past. So this is one scope of area where we can one area where there is scope for a lot of work to be done. And with regards to the numbers for the risk factors in the global scenario, 1.3 billion tobacco users and more than 7 million tobacco related deaths occur each year across the globe, which also includes 1.6 million non smokers who are exposed to secondhand smoke. 2.6 million deaths occur each year, which are attributable to alcohol consumption. 35 million children under the age of 5 years are currently overweight, and 390 million children between 5 to 19 years old are overweight or obese, and the obesity in adults has doubled since the year 1990. Also, interesting to note, nearly 7 million deaths occur each year due to air pollution, and 99% of the population are exposed to unsafe air pollution levels. This is just the data from NFHS 5, which shows that around 23 percentage of men and 24 percentage of women are obese. And this is compared with the NFHS 4, which is 2015-16 data. We could see there is a clear rise of around 5 percentage with regards to the obesity or overweight. Also, a 38 percentage of men consume or use uh, any form of tobacco, and 18.8 percentage of men they consume alcohol. All these are directly contributing to the rise in non-communicable diseases, especially in our country. So it is not only about the mortality and the DALIs, it is also about the socioeconomic impact which we should be concerned of. So poverty is closely related and closely linked to non-communicable diseases. Vulnerable and socially disadvantaged people, they get sicker and die sooner than people of high socioeconomic status, especially because these people who are vulnerable and socially disadvantaged, they have limited access to the healthcare services. And the rapid rise in non-communicable diseases is predicted to impede the poverty reduction initiatives, whatever the government is taking to eradicate poverty. All it becomes a question mark because of this increasing non-communicable diseases, which comes with increasing costs, out-of-pocket expenditure. And this scenario is true in India also. This is one of my recent studies where we determine the out-of-pocket expenditure among patients with diabetic foot ulcer in Madras Medical College. Here we found that the median out-of-pocket expenditure is around 30,000 rupees, which is too high for a country like India. and of this only 60% is towards direct medical costs, and rest 40% are towards loss of wages or transportation costs and other non-medical costs associated. Understanding the burden of non-communicable diseases, the World Health Organization has recognized this, and the Sustainable Development Goal has been framed in such a way that the burden of NCDs and premature deaths due to non-communicable diseases is targeted to be reduced by one third in the year 2030. And in 2019, the World Health Assembly extended the WHO Global Action Plan for the prevention of and control of NCDs, which is originally for 2013 to 2020. It has now been extended to 2030, and it called for the development of an implementation roadmap for the year 2023 to 2030 to accelerate process on preventing and controlling the non-communicable diseases. This is achieved with the help of 9 global targets with the greatest impact towards prevention and management of non-communicable diseases. So, few words about what we actually do on behalf of World Medical Association. So, World Medical Association is an international organization representing physicians, and it was founded in our year of independence, that is 1947, with 27 countries, which met in the first General Assembly. Currently, we have a strength of more than 115 national medical associations, and the purpose of World Medical Association is to serve humanity by endeavoring to achieve the highest international standards in medical education, medical science, medical art, and medical ethics, and healthcare for all people in the world. Out of different areas in which World Medical Association works, non-communicable diseases is a top priority in which WMA works. This we also have advocated for non-communicable disease-related things in the World Health Assembly, which happened in May 2025 in Geneva. I was a part of drafting the statements as well, and this statement, which we drafted and we released in the World Health Assembly, we have clearly stated that to achieve lasting progress, stronger commitments on holistic health system strengthening and investment in health workforce is needed. This includes commitment and one target on national workforce strategies with fair remuneration, occupational safety, and lifelong learning. So this clearly emphasizes how important it is for the governments to invest in health workforce. And this is a paper which I published 2 years ago, which was the stakeholder analysis for the hypertension management in the context of Indian public health system. Here also, we got a very similar finding. Our findings reveal that policymakers and program managers, they can lead this fight against hypertension and NCDs through a top-down approach. And for ensuring better performance of the healthcare system, health workforce is the obligatory pivot, and healthcare providers can be the point of convergence where the efforts made by different stakeholders, they converge, and they translate into results only through the healthcare workers. And it is very much essential that investments are made for strengthening the health workforce. This is just a table from my thesis, from my postgraduate thesis, which was on capacity evaluation of health and wellness centers in providing non-communicable disease services. So I have visited 21 different centers in my neighboring district, that is Jahanabad in Bihar. It clearly showed that not even a single PHC or health and wellness center had adequate manpower, which was recommended as per the Indian public health standards. That is the situation of manpower and health system in our country, and we need a lot of work is to be done. Though there are many initiatives which are taken by the government, like the Ayushman Bharat, like health and wellness centers, Ayushman Arogya Mandir. There are a lot of initiatives which are taken by the government, but still the distance we need to go is too long. We need to make more efforts in this direction, especially with regards to strengthening the health workforce. Also, we closely work with the World Health Organization, and we had a recent stakeholder consultation, and we participated in the second general meeting of the World Health Organization Global Coordination Mechanism on NCDs. Also, we contributed towards panel discussions, which was titled "Tackling the Determinants of NCDs and Mental Health Through Multi-Sectoral and Effective Governance and Collaborative Action." All this clearly indicates that NCD is not a one person game or a one department's game. Okay, it needs multi stakeholder approach. It needs support from the government, from the healthcare providers, from the civil societies, from the academia, from the research, from all various different partners needs to come together. Multi-sectoral approach is needed to tackle this growing burden of NCDs. So I had the opportunity of representing World Medical Association and have been at the fourth Global NCD Alliance Forum in Rwanda, in Africa. There, with the support of Global Health Advocacy Incubator, we organized a session where a civil society-led advocacy for prioritizing domestic resource mobilization for NCDs was advocated. Again, you know that the percentage of GDP which is spent in each country for health sector is very less. If I'm not wrong, for our country it is around 2.1, but we are targeting to achieve at least 2.5 percentage of GDP which goes towards the health sector. So, and how civil societies can play a role in this was discussed during that session. And again, these are some photos from my thesis, which shows that even common drugs like metformin and amlodipine are available in only or less than half of the PHCs in Bihar. Similarly, many services like estimation of lipid profile or oral examination was done in around half or less than half of the PHCs which I visited in Bihar. And whenever it comes to highest level of policy making, like the United Nations or World Health Assemblies, the role of civil society or the voice of civil society organizations are not given the importance it deserves. So we also advocate on behalf of World Medical Association that we need to include the civil society organizations in non-communicable related disease related advocacy. Also, we are trying to come up with different innovative approaches for tackling this growing burden of non-communicable diseases. So we have launched this initiative called Young Doctors Health Parliament. We did the first meeting in 2024. Thanks to Dr. Kripal sir from AIIMS Rajkot for supporting this initiative, which is an attempt to increase or to make the policy makers hear our voices. If you could see the deputy director of Indian Council of NCD division of the Indian Council of Medical Research was one of the invited speakers in that meeting, and we are trying to bring stakeholders from different domains and from different profiles together and try to make our advocacy efforts turn into policies so that the priority, though there are 100 priorities of government, NCD is a burning issue, and we are trying to take all efforts to to make to make the government realize the importance of non-communicable diseases and take actions accordingly. So to conclude, non-communicable diseases and mental health conditions, they prevent people and communities from reaching their full potential. They pose a heavy economic burden and they limit the human capital development, which can undermine the sustainability of health systems, and they compound the cycles of poverty. So there is a need for whole of government and whole of society approach to tackle the non-communicable diseases. It is high time we recognize this growing burden of NCD. We sensitize all the relevant stakeholders about this burden of NCDs. We promote research for non-communicable disease-related domains, and we translate all our research findings into advocacy efforts. And ultimately, this should reflect in policy making. Thank you so much, everyone. Thanks to AIIMS Rajkot, Dr. Kripal sir, and Department of CFM for this opportunity. Thank you.
Thank you, sir, for this wonderful deliberation on situation of non-communicable diseases globally and in India. As a token of appreciation, I request Dr. Vivek Kumar Sharma, sir, to kindly present the memento to the Dr. Venkatesh. Sir.
Request Dr. Kripal Joshi.
Now I request Dr. Krupal Joshi to receive the moment on behalf of the Dr. Venkatesh sir.
Thank you, sir. Thank you so much, sir.
Sir, we will send you in a courier.
Thank you. Thank you so much. Sir. Thank you so much.